In this video, we explore the phases of tissue healing. I'm Carolyn Zeff, and I'm an athletic therapist and osteopathic manual practitioner. I believe that by changing your state, story, and strategy, you can change your pain. Now, have you ever experienced a painful injury that resulted in pulled muscles, sprained ligament, broken bone, or maybe even, say, scraped your skin? If you have, well then I'm guessing that you know that your body, like the hero it is, springs immediately into repair mode. Our body is magical, and its internal intelligence mobilizes its self-organizing system towards tissue healing, and it does this in 4 overlapping phases. Now, these 4 overlapping phases of healing come in the form of the initial bleeding phase, followed by the inflammation phase, followed by the proliferation phase, and then finally the maturation phase. So say you've injured, say, a muscle or a ligament or fascial tissues, what do the phases of healing look like in action? Well, firstly, the initial bleeding phase begins right at the onset of injury. And in this phase, your body activates its emergency repair clotting system to stop the bleeding happening in the injured area due to capillaries that ruptured as a result of the injury. Now, roughly about 6 hours after the onset of injury, the inflammation phase of healing begins, and this phase will last for a few days or even up to a few weeks. And during this phase, white blood cells are removing pathogens and bacteria from the injured site, especially if skin was broken, as well as cleaning away damaged or dead cells that are a result of the trauma to the tissues from the injury. And classic inflammatory signs and symptoms we associate with the inflammation phase of healing come in the form of heat, swelling, redness, and sharp, intense pain. Now, in the next phase of healing, which is the proliferation phase, which is also known as the fibroblastic phase of healing, this phase is actually overlapping with the inflammatory phase, and it can start around 24 to 48 hours post-injury, and it can last for a few weeks. And in this phase of healing, our body is laying down collagen in an unorganized, messy manner in an effort to give the injured area needed strength. This tissue that is being laid down in the injury site is less elastic than the original tissue prior to injury and is referred to as scar tissue. Now, in the final phase of healing, which is the maturation or remodeling phase, the body starts to break down and reorganize scar tissue that was laid down in the proliferation phase so that it follows a more linear direction that mimics the fiber direction of the surrounding healthy tissues. Now, this helps to bring better quality, better strength, and better function to the scar tissue that replaced the healthy tissue. And in this phase of healing, it can actually last for a few months or even up to an entire full year. Now, the acute nociceptive pain, which is the pain we feel as a result of tissue damage after an injury, should reduce in its intensity with each healing phase and subside within about 3 months post-injury. Now, implemented rehabilitation protocol that incorporates a mind-body approach to healing will help to maximize each of these phases of healing. So recovery is complete, and you're also reducing the likelihood of pain becoming chronic. So I'd like to thank you for watching this video. And if you yourself have sustained an injury and would like my assistance in your recovery, please visit my website at www.carolynzeff.com and click on Book an Appointment to find a day and a time for an in-person or online visit.